Thank you, Dr. Umi. This is similar to already a surge in acute acquired comitant esotropia during COVID lockdown. So there are a lot of studies showing, I'll press the enter, that acute acquired non-accommodative comitant esotropia it's an uncommon type of esotropia and classified into three types by Berry and Miller in 1958 as the Swan type following monocular occlusion, Berry and Franchetti type associated with small refractive errors and minimal accommodative stress, and Belchowski type associated with moderate myopia and result from excessive near work activities. Neurological problems like Chiari malformation, posterior fossa tumors, and hydrocephalus have been seen to be the culprit also, and they warrant imaging. Excessive near work, including excessive smartphone use, have been found to be a cause, and with the advent of COVID-19 universal lockdown and introduction of web-based online classes, there has been a higher incidence which is attributable to the stress and accommodative load. So this was a retrospective comparative analysis to show that during COVID lockdown, there was a surge in the incidence of AACE and compared to a similar period prior to COVID lockdown. So the medical records of all cases who presented with acute onset of comitant non-accommodative esotropia to the Department of Pediatric Ophthalmology in Contrast Eye Hospital were analyzed, and they were classified into Group A, those during the period from June 2020 to August 2021, and Group B, those during the period from June 2018 to August 2019. That's a period during COVID lockdown and similar period pre-COVID to avoid differences during examination times or other factors which might influence the number of cases. So all had a detailed history of ophthalmic evaluation and muscle balance, ocular motility, cycloplegic refraction, fundus, best corrected visual acuity, PBCT and accommodation facility, and Worth 4-dot test in older children. In the younger children, atropine refraction was done, and MRI and neurological evaluation done in all cases, and those patients who presented within 3 months of onset and were willing for Botox injection were given the same and followed up. Those who had stable angles after 6 months and showed no progression or recovery were taken up for surgical correction. So these were the number of cases: 41 cases in during COVID lockdown and 11 cases during a similar period pre-COVID. The 79% of the total cases were during COVID lockdown. 60% of Group A were males, whereas 61% of Group B were females. And 33 patients in Group A, 80% had more than 3 hours of smartphone use. And in Group B, we did not get a proper history of smartphone use. Age distribution, majority, that is 70% Group A, belonged to age group 5 to 19 years, and 44% were about between 10 to 19 years, and the mean age was 11.23 years in Group A. And the mean age in Group B was 73% in Group B belonged to 5 to 19 years, and 45% were between 10 to 19 years. There were no patients below 5 years in Group B, and mean age was 16.7 years. And the presenting complaints, 44% in Group A, complaint of diplopia, and 55% of Group B presented with double vision. The type of AAC during COVID period, 38, that is 93% of Group A belonged to Berry and Franchetti group, that is stress induced, and only 9% of Group A belonged to Belchowski's type. And only one, that is 9%, was Swan type. One patient had a pineal mass and was taken up by the neurosurgeon for surgery. And pre-COVID period, that is Group B, 6, that is only 55% of Group B belonged to Berry and Franchetti group. None showed Swan type. 4, that is 36% in Group B, belonged to Belchowski type. And one had neurological findings in MRI with an arachnoid cyst and Chiari-like malformation in MRI, which according to the neurosurgeon was not significant. The mean angle of deviation for distance was 39 prisms, varying between 18 to 70, and for near 43, that is 20 to 17 group A, and mean angle of deviation for distance was 33 prisms, that varying between 25 to 45, and for near 35 prisms, 25 range between 25 to 50 in group B, and none of them showed accommodation abnormalities. The mean spherical refractive error in A was +2 diopters, ranging from -3 to +4, with only one myopic, that is 2.4%. In B, mean spherical refractive error was -1 diopter, ranging between -5 to +2 diopter, with the 4 being myopic. Mean best corrected visual acuity was 0.96 in both groups. In group A, 5 patients had Botox injection, 5 units to both medial recti, out of which 4 showed recurrence of squinting after 12 weeks of post-injection, and 6 patients had surgical correction. All had recess resection procedure with one with inferior oblique recession as well. In group B, 3 had Botox injection, all of whom later recurred, and a recess resection was done. 6 patients had recess resection after follow-up of deviation for stability. Coming to discussion, web-based online classes and jobs have a great impact on visual demand, which is shown by the great number of AACE cases during lockdown. Majority of the cases, that is 93% during this lockdown period, was Berrien-Franchetti type. And in pre-COVID series, 36 patients belong to Belchowski type. Lee et al. Have shown all their cases to belong to Belchowski type, whereas in group A we had only one case in this type with myopia. Aldo et al. Reported 4 cases with more than 8 hours of near work during COVID lockdown, and Hyo Lee et al. Reported 12 cases following excessive smartphone use. Amit Mohan et al. Have shown a mean age of 12.5 years during the lockdown. In our case, 73% of our cases during the lockdown belong to age group 5 to 19 years, whereas 44% were between 11 to 19 years, which demands more online work, which also points to the causative factor as use of digital media, especially smartphones. Our mean age was 11.2 years. Awareness need to be created to limit the smartphone use for online classes. So COVID lockdown has increased digital media use and a surge in AACE. The high percentage of students who need visual demand at online classes are at higher risk of developing AACE, and they need to be educated on visual hygiene at computer, and smartphone use should be restricted appropriately.